his speech. So in this, it is my honor to welcome you to this meeting, joint annual scientific at the conference, and the 8th Uganda Medical Association
But we have another camera.
and the General Doctors Conference. And as we look at our theme of this conference, it says that global health securities through partnerships for epidemic response and control in Sub-Saharan Africa, where we find Uganda. And this speaks to the importance of partnerships in strengthening our abilities to effectively respond to most of these public health emergencies that tend to threaten humanity in our region. So the Uganda Medical Association is deeply committed to safeguarding for the entire health of our nation, both in good and difficult times. So in times of outbreaks, epidemics, and pandemics, we have seen us as members of the Uganda Medical Association playing a very critical role in the front line, and we have been faithful in the crisis management and mitigating the impact of most of these public emergencies. So we have done it through a number of organizations, and also both mobilizing the human source and other sources through partnerships and enhancing community awareness as well as engaging the policymakers during
planning. And as Uganda Medical Association, we are instrumental in ensuring that we swiftly and coordinate the responses through collaborations, and especially through our main line ministry, that is Ministry of Health, and diverse stakeholders, as already alluded to. If you look on one of the charts, to fight most of these pandemics, you can't do it alone because they are resource intensive and extensive. So if we borrow leaf from what we went through during the COVID-19 pandemic, which started around December 2019, and we fought it up to around 2020. We remember the impact was quite intense, and apart from losing the ordinary people, we also lost a number of health workers. But with the help of the partners and the collaborations that we had, we were able to overcome this. And you remember the outbreak of Ebola virus disease that was in Mubende and Kesanda. We had a lot of engagements and collaboration from our partners, and we were able to end it. And even the current one, which is Mpox, we have a number of partners that we are working with to make sure that we fight these outbreaks. So as co-sponsors of the joint annual scientific health conference of this year, we are proud to continue this tradition, and we shall always collaborate and make sure that we build our capacity to continue fighting this epidemics. And as you know that we are in this region where we have a number of tropical diseases, this becomes a very big challenge that is always in and out of our area. So this conference will offer a valuable platform to exploring innovations and strategies so that we're able to strengthen our epidemic response, prevention and control in this region. And you know that we are not an island. We always have neighbors around, and some of them are very prone, so we always need to be on our toes as we fight this pandemic. So it is through these partnerships that we have built a resilient health system that is capable of addressing the challenges of these public health emergencies. And we shall also continue to make sure that we secure the future that is safer for everybody. So I will encourage all attendees to actively participate in the discussions during this workshop and utilize the networks that are available so that you take them as opportunities for you to make sure that we overcome most of these diseases. And let us work together to ensure that the outcomes of this conference translate into concrete and be able to fight the diseases that are in this region of Sub-Saharan Africa. So thank you for your commitment to advancing health in our communities. And I wish you a productive and engaging conference 2024 for God and my country.
Thank you very much, Dr. Kawel, for ably representing the UMA President. The message is taken. And at this moment, I would like to invite Professor Robert Basaza, the President of UNAC, Uganda National Association of Community and Occupational Health. Professor Basaza is a professor of public health and health economics at Uganda Christian University. That must be in Mukono. I think he has a big package on occupational issues. Professor, you're welcome.
The Master of Ceremonies, the Chair of the Organizing Committee, the Principal of the College of Health Sciences, Professor Damarin Nakanjaku, distinguished delegates, ladies and gentlemen, it's with great pleasure that UNACO, in collaboration with the Makerere University College of Health Sciences and Uganda Medical Association, has played a part in organizing this conference. UNACO, Uganda National Association of Community and Occupational Health, cuts across all health professions. We are the organization that brings together all the health workforce, and to the theme, we are in the forefront of containing the epidemic and other emergencies. And therefore, at this conference, we are here to share experiences. We are here to learn from other collaborators. We are here to enhance knowledge in combating epidemics and fostering collaboration. It's a great day for us in that later in the conference on Friday, we shall host Dr. Matthew Lukwia Memorial Lecture, where we remember all the health workers who have died in the line of service. On a special note, we are also working with the universities and fostering the establishment of the East and Central African College of Public Health. So we look forward to deliberations and buy-in from all the dear delegates. I wish you a nice and successful stay during the conference. Make friends, enroll also in UNACO and support our organization. For God and my country.
Thank you very much, Professor Masaza. Professor Masaza has written a book which he hasn't told you about. I think he will tell you about it in the break and networking session. He has written a very good book that I hope you brought a copy with you, Prof. Masaza, that you'll be able to sign an autograph for everybody here. So it's my great opportunity to invite our next speaker. Our next speaker is Dr. David Katete, who is the Dean of the School of Biomedical Sciences of Makerere University. Dr. Katete is a renowned researcher, especially in the area of tuberculosis and genomics, as well as bioinformatics, and is spearheading the PhD program together with his team and the whole of the College of Health Sciences. They are spearheading the program on bioinformatics, both at master's level and PhD level. So, Dr. Katete, I hope you're going to be able to teach us some things about DNA, because we forgot all about them since we came out into the field. Thank you so much. Welcome, Dr. Katete, with me. Please, some hand claps. Thank you, Dr. Katete.
Thank you for the kind introduction, Dr. Naku. And actually, DNA is about life. And whatever you say, living things, all the characteristics behind that, that's the message encoded in DNA. And I'll stop at that and turn to the conference. And I take this opportunity, once again, as the current dean of the organizing school, the School of Biomedical Sciences, to welcome you all here to take part, to be part of this key event. As the organizing school, we feel this event, this year's event, is so special to us. First of all, in two ways. The College of Health Sciences is celebrating 100 years of existence, and this year's event is part of that. And we've had pre-conference activities that were started, I think, 3 weeks ago. And this week, we are at the hallmark of celebrating 100 years of existence as the Faculty of Medicine, now College of Health Sciences. And yesterday, we had the Vice Chancellor come to Mulago and several other dignitaries. And some of you who were there witnessed, probably the principal will talk more about that. So this year's event is part of our existence for 100 years. And I would want to thank you to be part of that. And secondly, I think I would like to thank the chair organizing committee for the job well done. When we started organizing for these events, I think the principal College of Health Sciences tasked us to have a holistic event, not necessarily dominated by one school of biomedical sciences. And when I see the representation, I can't thank you enough, Chair and the organizing committee, for the job well done. Thank you for all the partners who have supported this event. It's not, and at this point, I would want to thank the support that we've received from the USAID through the various activities in Uganda. For example, the Uganda Health Activity, the AfroHun, and the other support we've received from the college, for example, the Child Health Development Center, the School of Public Health, the Integrated Biorepository Uganda, MBN, Baby Jail, Happy Project, the NDA, UMA, UNACO, and so many others. I'm just mentioning a few who have supported this event. And I would also like to thank the presence of the representatives from the WHO. Thank you for taking out of your special, thank you for being part of this event. The CDC country director, thank you for for coming. The USAID country director, thank you for taking part of this event. And so thank you very much for turning and coming to this event. Thank you very much. Over to you, Master of Ceremony.
Thank you, Professor David Katete, the Dean School of Biomedical Sciences, for that brief but informative keynote, for those remarks. At this time, I would like to invite the principal, Makerere University College of Health Sciences, Professor Damali Nakanjako, to tell us briefly how the college she heads is participating in building capacity or building global health resilience through strategic partnerships. Professor Damali is a physician, and she's a clinical immunologist. You can see she's very energetic, still having a lot of years to serve. You are welcome. Please.
Ladies and gentlemen, allow me to stand on the protocol that has been laid out by my previous speakers, but I'd love to say good morning, ladies and gentlemen. It is my great pleasure to welcome you to the 18th Annual Scientific Conference of the College of Health Sciences. And this conference, like has been mentioned, is jointly organized with the Uganda Medical Association and the Uganda National Association of Community and Occupational Health, UNACO. This year's theme of the conference is Global Health Security, Partnerships for Epidemic Response and Control in Sub-Saharan Africa. And this is a very timely theme as we reflect on the recent crisis, the importance of building resilience through global partnerships cannot be understated. This is why we gather today to strengthen global systems and our ability to respond effectively to outbreaks. As has been mentioned by the Dean School of Biomedical Sciences, this conference coincides with our celebration of 100 years of medical education at Makerere University. And this series of celebrations were launched yesterday by the Vice Chancellor at the College of Health Sciences. I see a few of you who are here attended that event. Thank you very much. And this is the second of a series of activities. So all our alumni, our partners, well-wishers and friends, you're welcome to participate in these events as we strategize for the next 100 years. You said there is a pointer. How do I move the slides? So we alternate leadership of this conference through our 5 schools at the College of Health Sciences. So I want to take this moment to thank the School of Biomedical Sciences for a great job well done, led by the Dean, Professor Katete. Please give a round of applause to the team. I also want to recognize the chair of the conference, Dr. Haruna Monge. Please stand up for recognition. And your team. And of course, I want to thank our long-term partners, UNACO, led by the president of UNACO, and the Uganda Medical Association. This is a great gesture of South-to-South collaboration. And this is the kind of partnership that we are going to strengthen. These are the type of partnerships that are going to take us to the next century. So I want to briefly tell you a little bit of history about our medical education in Uganda as we celebrate 100 years. Makerere University, the medical school was established in 1924 and is the oldest medical school in Eastern Central Africa. I think I can recognize maybe about 2 or 3 people that know about this information. So the rest of you, Gen Zs, this may be new information for you. So the medical school started with less than 50 students, and it was teaching mainly doctors at a lower level. But today we have over 3,500 students, and these are not only medical doctors, but they are all health professionals, as you can see: doctors, pharmacists, dental surgeons, nurses, speech and language therapists, biomedical engineers, biomedical scientists, cytotechnologists, environmental scientists, optometrists, palliative care specialists, and so on, because we realize that these are very relevant to healthcare. Hence, in 2008, we established the College of Health Sciences, which is today what was previously the medical school. Thank you. So, since 1924, I don't want to say that we recall, because some of you may not recall, but you have read that in 1997, that is when Mulago Hospital was originally founded by Sir Albert Cook, and Mulago Hospital was established as a teaching hospital. And between 1924 and 1928, our graduates were receiving the senior native assistant certificates. In 1950, they started getting licentiate in medicine and later a degree in medicine. So it's about 30 years later, 1958, that we had the first doctor graduate, the first female doctor graduate in medicine. And subsequently, it became the Faculty of Medicine, and like I've mentioned, in 2008, fast forward, we became a College of Health Sciences. So why do we exist? I need to remind you that our vision is to be a leading and transformational institution for academic excellence and innovation in health sciences in Africa. And our mission is to improve the health of the people of Uganda through innovative teaching, research, and provision of services responsive to societal needs. So that is why we exist. When the society stops having needs, then we shall stop to exist. These are our core values: innovativeness and adaptability, social accountability, diversity, excellence and quality, equity and social justice, and professionalism. Why do I mention them here? Because these are core to the subject that we are discussing, which is global health security, the theme for this conference. So as a teaching institution, I just want to take you through what we are facing with the 21st century learner. The 21st century learner needs to be a self-directed learner, an innovator with critical thinking, a problem solver, a collaborator, and someone who is civically engaged. So these are the critical skills and competences that we want our health professionals to have so that they can face the 21st century patient with the emerging and re-emerging healthcare challenges. So this is just to give you the anatomy of the College of Health Sciences. As I mentioned, we have 5 schools: the School of Biomedical Sciences, the School of Medicine, the School of Public Health, the School of Health Sciences, and the School of Dentistry, with various departments. This gives us a platform to have interprofessional education, student-centered learning, problem-based learning, competence-based learning, and we also have a big component of community-based education and research. As you will know, epidemic response requires an agile, innovative, and multidisciplinary approaches to training. And for service delivery, community engagement, and this is required to inform policy, partnerships, as well as politics. So that is really our core business. We have partnerships in training. As you'll see, all these are training sites that we collaborate with. Mulago Referral Hospital, Uganda Art Institute, the Women Hospital, Butavika Hospital, and so on, because we train in different sites to be able to give our trainees all the skills that they need to serve in these communities. We collaborate with several local and international institutions. This is work that we published in our journal talking about health service delivery and training at Makerere University, the role of academic health centers network, because we represent a big academic health center network with all the training institutions where we train our students. What we have learned over the years, several things. Some of the lessons that we need to look at that will take us into the next 100 years. One is that information technology and artificial intelligence are major forces in cultivating a more informed consumer of our trainees, of our services, and higher levels of quality and safety for our patients. Secondly, we need to understand that healthcare, like all industries, is affected by globalization, which speeds transfer of knowledge, but also disease transmission. These are very important for us, even as we reflect on global security. Academic health centers, therefore, need to be equipped for innovation, research, and training, and agility to address ever-changing challenges to global health. Inter-university collaborations between high-income and low-income countries are very important to enable a transfer of skills. We also need to note that funding agencies need to promote multidisciplinary collaborations collectively linked through academic centers. So this is just to give you a snapshot of the interprofessional education, interprofessional practice, and intersectoral collaborations that we need to have for us to collectively address our global health security agenda. Of course, we have the different health workers, like I've mentioned them, nurses, doctors, radiographers, laboratory specialists, environmental scientists, etc. We need the policymakers, politicians, economists, the funders. We all need to come back to the table. We need to perceive that health is not only in the hands of health workers. We need an intersectoral approach. Other sectors like the energy sector, agriculture sector, water and sanitation, trade and industry, transport, tourism, media, many of these are not recognizing their role in health. So we need to recognize the role of all these sectors in health for us to implement a One Health approach to health, leaving no one behind. So it's really teamwork, and most of we need to find out, I don't know if I ask a question, of all these members of the team, who is the most important member? You would need to reflect. Who is the most important member? Are all these team members equally important? Who has been left behind? Maybe that's why we are where we are, because not all of us are putting in everything that we need to put in into this jigsaw puzzle for us to have a resilient response to global health. We need to build partnerships, we need to sustain them, and they need to be effective partnerships. And we need to train leaders. We have written about this, our experiences in the partnerships, and I'll just give you an overview of the different types of partnerships that we have engaged in to be able to respond to global health challenges. We have bilateral and multilateral organizations, academic and research institutes, ministries of health and other governmental organizations, non-governmental organizations and community groups, the private sector and industry, and disease-specific and other strategic partnerships. All these need to come together to address the same problem for us to move forward. So I'll briefly just give you a snapshot of the 100 years of what we have contributed as Makerere University and what our role is in responding to the different health challenges, including epidemics and new diseases. In 1948, over this time, since 1948, we have been conducting transformative clinical research at Makerere University. For example, in 1948, science at Makerere University described endomyocardial fibrosis as a new disease, and a lot has been done on that. In 1958, Burkitt's lymphoma was first documented at Makerere University, and since then, it led to the establishment of the Cancer Institute, and it has transformed care of children with Burkitt's lymphoma, not only in Uganda, but globally. The Buruli ulcer caused by Mycobacterium ulcerans infection was also described here at Makerere University. In the 1960s, the first cardiac catheterization laboratory was set up in Sub-Saharan Africa, here. We have Kaposi sarcoma. You've heard of this Kaposi sarcoma, first described at Makerere University. Fast forward, we have, in 1985, scientists at Makerere University, some of them are here, Professor Serwada is here, they described Lyme disease. And since then, we have had a great response to the HIV epidemic. We have several examples of strategic partnerships that Makerere University has engaged in response to the different epidemics. A case in point is the Infectious Disease Institute, which was set up to respond to the HIV epidemic over 30 years ago. And today, a lot has been done in that institute, expanding even to other diseases. Makerere University has collaborated with the Uganda Heart Institute since to have collaborative cardiovascular disease training since 1988. We have developed capacity for implementation of evaluation of vaccine trials through the collaboration with Makerere University Water Read project. We report developments in lung science, research and training at Makerere University, and several other collaborations. These are just to show you that wherever there's a response, we come in and collaborate to find a solution. This is the African Centers of Excellence in Bioinformatics at the Infectious Disease Institute, funded by the NIH, promote data science and artificial intelligence in health professions training and research. During the COVID-19, this unit was very active and developed a virtual reality training for health workers during the COVID-19 pandemic. These are the kind of innovations that we benefit from the collaborations. We had several public-private partnerships to support the increased demand of PPE during the COVID-19 pandemic. And these are some of the private partners that supported. We have several partnerships for training, where we have several of our trainees go to different countries, different centers of excellence, and we have technology transfer to our low and middle income countries to build our capacity to respond to outbreaks and other health challenges. This too is very important. We have partnerships in dissemination and uptake of research. And 18 years ago, the College of Health Sciences started this forum, which is the annual scientific conference. And I'll tell you that the 16th scientific conference, the theme was the role of health professions education in strengthening health systems, research, global and community health for economic development. We had the teams respond to global health challenges. A case in point is antimicrobial resistance. At that time, we hosted the first antimicrobial resistance symposium, and we collaborated with the Mining and Occupational Health and Safety Conference. This is just to show you that we need collaborations to disseminate data for uptake, for it to be utilized in policy. We also hosted the 5th Evidence to Action Conference, and we continue to be a part of this series of conferences, the Health to Evidence to Action Conference. Last year, our theme for the 17th conference was Advancing Health Opportunities and Innovations in the Face of Emerging and Re-emerging Global Health Challenges. Several results were presented there, and many have gone into policy. We are back this year with a very important topic, which is global health security, partnerships for epidemic response and control in Sub-Saharan Africa. Please watch the space. A lot is going to be presented, and make sure you use the opportunities to share. So as I conclude, the best way to build successful, transformative, resilient response to outbreaks is to embrace the principles and practices of equitable partnerships. Secondly, the formation, monitoring, and sustainability of the partnerships and all aspects of the partnerships require constant vigilance and review. At fora like these and others, we need to regularly review our partnerships. It is important to know that when created and nurtured correctly, equitable partnerships and mutually beneficial partnerships play a critical role in the success of global health leadership training programs and outbreak response. Academia plays a central role in the formation and sustainability of multi-institutional, multi-country, multidisciplinary, and multi-sector partnerships. And this is what is needed. So ladies and gentlemen, I thank you and I welcome you for coming to celebrate with us the Center of Excellence in shaping the future of medical education as we build for the future at Makerere University for God and my country. I wish to appreciate all our collaborators and reaffirm that the College of Health Sciences is committed to continue the fight to have global health, which is a common good. Special thanks to our partners, including USAID, Uganda Health Activity, AfroHoon, Baylor College of Medicine, Children Foundation, Uganda, the Biorepository Project at Makerere University, the Infectious Disease Institute, HAPI Project, MBN Clinical Laboratories, and all other partners that have supported us. Most importantly, special thanks to all of you that have taken your valuable time to come and share with us this event. Thank you.
Thank you very much. Professor Damali Nakanjako, Principal, Makerere University College of Health Sciences. We've learned that partnerships are the way to go. Strategic ones, not just partnerships, but what? Strategic ones. And these ones, as you can imagine, they start at home. If at home there is no strategic partnerships at home, things don't move on well. And now we are now here in the conference room still putting this message forward, strategic partnerships. Without them, even I don't know how the college or the university would have survived all of these years. Even this conference is taking place because of strategic partnerships. So we've learned a message. Thank you, Principal. At this moment, I would have requested the Principal to invite the Vice Chancellor, but I have been told that the same Principal is the one representing the Vice Chancellor. So it would be very unkind for me to say you invite yourself. For that reason, I'll go ahead and invite the Vice Chancellor to come and give a keynote speech to the meeting. Professor Daman, you are welcome once again.
Ladies and gentlemen, now I've put on different shoes as the Vice Chancellor of Makerere University. The Vice Chancellor is unable to be here. He sends his apologies, and he sent the First Deputy Vice Chancellor, Academic Affairs, who has also been called for an urgent meeting. Nevertheless, their words are here, and I'll read them verbatim. The Vice Chancellor was asked to talk about the role of higher education institutions in global health response to outbreaks, pandemics, and epidemics. And he reads that the Honorable Minister represented, members of the Honorable Minister of Health represented, members of Makerere University Council present, the Director of Africa CDC, outgoing WHO country representative, the USAID and CDC country representatives, the President of UNACO, the President of UMA, colleagues at Makerere University and top management, distinguished keynote speakers, the Principal, Makerere University College of Health Sciences, and our esteemed partners, distinguished scholars present, all participants present, ladies and gentlemen, it is indeed my great honor to address you today at the 18th Joint Annual Scientific Conference organized by Makerere University College of Health Sciences and the Uganda National Association of Community and Occupational Health and the Uganda Medical Association. This occurrence remains a crucial platform for addressing key healthcare challenges in Sub-Saharan Africa, fostering meaningful dialogue and collaboration among experts, policymakers, and practitioners. This year's theme for our joint annual scientific conference, Global Health Security, Partnerships for Epidemic Response and Control in Sub-Saharan Africa, reflects the urgent need to leverage the strength of institutions like Makerere University in building resilient health systems. Today, I will highlight the critical role of higher education institutions in the global health response to pandemics and epidemics. I'll also share how Makerere University, through its centers of excellence, played a pivotal role during the COVID-19 pandemic and Ebola outbreak. Our unique combination of research, policy development, workforce training, and community outreach enables Makerere University as a higher education institution to contribute to global health security in meaningful ways, which include, 1, research and innovation, where Makerere hosts hubs of scientific research and innovation, and these have been very instrumental in the national response to COVID-19. The Makerere University Lung Institute, through its vaccine and epidemic research, played a key role in testing and evaluating vaccines to ensure that they were suited for our population. Staff at Makerere University engaged in as policy advisors during the COVID-19 pandemic. Training and capacity building. Makerere plays a critical role in training healthcare professionals who can respond to outbreaks. Makerere deployed students and staff to assist testing, contact tracing, and managing quarantine centers during COVID-19. Similarly, we continue to develop next generation public health leaders through our training programs, ensuring that Uganda's health workforce is prepared to tackle future epidemics. In addition, there's community engagement and education. Makerere University, in collaboration with the Infectious Diseases Institute, launched public education campaigns to combat misinformation, increase vaccine uptake, and support community health workers during the COVID-19 pandemic. We leverage digital platforms to spread accurate information and promote safe behaviors during the pandemic. Makerere University also supported diagnostics through the Makerere University Biomedical Research Center, which developed diagnostic kits to support diagnosis during the epidemic. The use of digital health and data science has also helped to respond to epidemics. Our use of AI and data science tools enabled more accurate prediction models and better allocation of resources to pandemic hotspots. I'll now talk about the response to the Ebola outbreak. Makerere University has a long history of responding to health crises, including the Ebola outbreak, where Makerere University, through collaboration with the Water Read program, has conducted extensive research on Ebola vaccines, diagnostics, therapeutics, and other interventions. MURAP has been instrumental in establishing rapid diagnostic testing protocols during the Ebola outbreak. Makerere scientists have continued to lead in the response to Ebola through training, diagnostics, and scientific leadership. Now, looking ahead as we build for the future for epidemic preparedness. As we reflect on these accomplishments, it is clear that higher education institutions must continue leading in epidemic preparedness and response. Makerere University is committed to advancing the following areas. 1, interdisciplinary research and innovation, fostering collaboration. Our centers of excellence will continue to foster innovation to respond to current and emerging epidemics. Secondly, we'll continue to build capacity in data science and artificial intelligence to improve modeling and preparedness to respond quickly to epidemics. This will be critical in developing resilient health systems that handle both known and emerging threats. Makerere University is also committed to harness global partnerships. Our partnerships with organizations such as World Health Organization, Africa CDC, the US CDC, USAID, and other international global health institutions will continue to strengthen our capacity to respond to global health threats. We must also expand our collaboration with our regional partners to ensure a coordinated and effective response to health emergencies. Ladies and gentlemen, higher education institutions are uniquely positioned